Hi, it's Dr. Bishop, and another question we got on the patient survey that people would like to hear from us about is menopause. And so I wanted to start with a little bit of background information. The average age in the United States for menopause is 51. However, and this might be bad news to some of you, perimenopause can last for up to 10 years. So you can kind of be in that perimenopausal phase for almost 10 years. The typical symptoms that everyone associates would be like hot flashes, night sweats, mood swings, things like that. But some of the more obscure things that might be happening that you don't really connect to being perimenopausal or menopausal would be like stubborn belly fat, or you start putting weight on around the middle that's you're not sure why, increased brain fog and it's a little bit harder to think, some low-level anxiety or disruption in sleep patterns. So if you're starting to feel that way, make sure you let us know. The typical route that a lot of people follow, and it kind of makes me sad because women obviously know something's wrong, and they'll go to their primary care doctor who will usually kind of run their thyroid and say, oh yeah, your thyroid looks good. And then the women will say, well, I think it's hormonal. And so they'll send you to the OBGYN, and the OBs usually say, well, you're getting older, you don't really need hormones, but here's an antidepressant. And that's a really typical kind of way that people get shuffled through the system. And so I wanted to talk about how our approach is a little bit different as naturopathic physicians. First of all, we almost always do blood levels to check your actual numbers so that we know how to dose you should you decide to do like a bioidentical hormone replacement. But I also want you to know that there's other options if you maybe had a breast cancer or you have a family history of breast cancer and you're not a good candidate for hormone replacement therapy. There's still lots of options. So we use a lot of botanical medicine. So some of the plants have really good methods of helping get people through menopause. So lots and lots of things that we can do. So please let us know if you're experiencing some of those symptoms or have further questions. Thanks.